Hello, my name is Dianne Khlok. I am a graduating senior at UC Davis. I am studying sociology and minoring in public health. My pronouns are she and they. I am Khmer-American. I am Southeast Asian. We are resilient individuals. We are a resilient community. We have survived so many things. What I wish for our community is to thrive in life. I wish for us all to rise by uplifting each other. I believe that we can grow, that we can thrive, that we can improve our mental health collectively. A lot of Asian Pacific Islander communities are hesitant to receive mental health because it exposes a vulnerable aspect of ourselves. Our communities have gone through so many things, especially in the past year. That's anti-Asian hate. It is historical trauma and intergenerational trauma from war or from being migrants in the world. Something that attributes to this mental health disparity, especially in the AAPI community, is there's not enough social, cultural, health benefits and reach to our communities. We struggle with asking for help. Those resources aren't always culturally competent. It's not necessarily in our cultural language. It's very difficult when we do not have that bridge to cross. So it's very important that we have those mental health advocates who are culturally competent, who speak our language, who understand where we're coming from. That's one way we can improve our mental health in our communities. I think our communities hesitate to be vulnerable and to get the resource. We could address these problems and these disparities in mental health reach is to do outreaching, making our communities more comfortable, more practiced into accessing mental health resources, to become empowered into being healthier, being happier, and striving to really thrive in our lives. I have struggled all my life with mental health. I learned about mental health later in life, maybe a little after high school. I realized that I needed to stop to take care of myself, be really vulnerable, and to be honest of how I'm feeling, what I'm going through. I can't keep pushing back my mental health problems. Mental health is a hugely personal journey. It's something that is so needed in our lives. Something that I have done is put trust in the process. I reach out to counselors who are there for students. I reach out to people who are receptive to me, who are able to offer their help and guidance, and that's something I wish for everyone to practice and to reach for. Destigmatizing mental health begins with ourselves. I had to let go a lot of the misconceptions about mental health. It's a show of strength to be vulnerable, to say that I'm not okay, I'm struggling. It's okay to be emotional and cry, and to let others know that, hey, I need support. Destigmatizing mental health means that we take a step forward into being our most true selves. It means that we take courage and empowerment to ask for help and receive that help. Don't stop no matter what in asking for help. I'm a proud daughter of Cambodian refugees. There's a lot of intergenerational trauma, PTSD, that are related to war, displacement, and rerooting ourselves in the US. We are so used to this mentality of survival. One of the things that we learn in mental health is that we need to take care of ourselves. We need to be able to be vulnerable enough to ask for help in order to truly thrive in life. And that's something I really wish for everyone in my community. We deserve it, and we can get there together. My personal experience with mental health started in high school. I realized that relationships are so important into building mental health techniques and skills and being able to connect with others to support myself in my mental health. Something that has helped me tremendously is counselors at every level, high school, community college, UC Davis. If we take the courage to ask for help and for those resources, I feel most supported and affirmed when I support and affirm myself to get those resources, to admit that I have an issue that I want to address, and that I need help and support. Help and support doesn't just come from ourselves, it comes from all those around us. I grew to be an advocate for mental health. I just want to say that we're doing a great job of taking care of ourselves already. The best thing we can do for ourselves is to connect with one another, support each other, and really strive to thrive in our lives. For someone who's struggling with mental health, who is navigating the waters of it, I am cheering for you. You're doing the best that you can. I'm so proud of you. I encourage you to reach a hand out, ask for help for anyone around you, and keep asking for help, asking for resources. Some of the most important people to talk to, especially as a student at UC Davis, is counselors. Connect with your counselors who are so full of resources. They can help connect you to the resources that you need to improve your mental health.